What's going on, everyone? Happy Thursday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Thursday edition of the Pandemic Update for Thursday, May 16th, 2024. If you're new to my channel, this is where we do the daily Pandemic Update on all things COVID and any other virus that could be a health threat to you. Let's face it, there are a lot of viruses out there, and we're going to talk about several different ones today. Each of them carry a health risk to you, your family, your loved ones, your friends. Want to stay informed with what's going on? Subscribe to my channel down below. It's really the best way to be on top of what's going on. I look up all the news stories, report them to you each and every day. That way you're in the know of what is going on. Like today's video, give it a thumbs up. The more people that give these videos a thumbs up, the more YouTube will push them out throughout the algorithm. Let's try for 125 like button hits today. Leave a comment down below if you have anything to say. And of course, if you would like to, share this with anyone you know. Alrighty, we have a ton of news stories to get through today. We do have some data to take a look at in wastewater that I want to show you from Wastewater Scan. We have some state data. We have some of our daily data. We have some weekly state data. So yes, we have a lot of things to get through. We're going to try and keep this under 20 minutes, although it's not going to be easy. All right, starting off, you may have heard by now, if you are on Twitter or if you are an avid person who still takes COVID precautions, North Carolina has gone to the step to ban people from wearing masks. Now, it's not final yet, but it's it's very close to it. It just has to go through, I think on May 20th, there's going to be one more vote or something, but it's already passed the Senate in North Carolina. And this doesn't just mean, oh, well, you want to wear a mask to keep yourself safe. No, no, no. If you have a health reason in North Carolina, see this N95 mask? North Carolina is basically saying, you will not be allowed to wear a mask whatsoever. Yeah, totally ridiculous. I think it's ridiculous as well, and unfortunately, I am very concerned this could soon become more states. Now, while North Carolina is out there banning masks, I thought this was rather interesting. An article from the Seattle Times says this in the headline. I'm just going to read the headline. Restock your N95, KN95 face mask as new COVID-19 variant flirt rises. So, this article, and you don't see this very often this day and age, is actually saying time to stock up once again on masks because of the flirt variants. And we're going to take a look at some new data, new wastewater data in a minute that shows, in a few minutes, that shows it may be rising once again. All right, moving on to this now. We're not doing anything in any particular order. There's a lot of news, so I'm just going to move on to this story now. First case of human contracting bird flu from a dairy cow has now been confirmed by officials. The virus has jumped. So before we were hearing a human tested positive for H5N1, but now it is being confirmed that yes, that person did have H5N1 and it was a Texas dairy farm worker. Okay, moving on to this. This is the same story, so don't need to show that to you twice. But I do need to show you this. Human case of West Nile virus confirmed in Shelby County, Tennessee. So, yeah, that's not a good thing. You know, those mosquitoes, climate change, and we will do our little daily bump for climate in a moment. Climate change is real, and when we have wetter patterns, there's more mosquitoes. Mosquitoes can carry disease. Moving on to this. Now, this is something that I took a picture of today. So I was doing a CVS delivery this morning. There's an app that I can do. I do several different apps, as you all know. Or if you're new, maybe you don't know. I do deliveries. I do all the different delivery apps. And I can pick up CVS gigs for delivery. So I said, you know what? Let me whip out my AirNet and see what the air quality value is in that CVS. Now, mind you, it wasn't that crowded there. The building was about 5 to 10 years old. Someone did ask about that, and I think it was built within the last 5 to 10 years. Look at our reading, 532. That's even better than the reading I'm getting here recording in my office, which is 950 right now. Because, as you know, I'm constantly talking. I had to shut the purifier off so I could record this. And, I mean, that's fantastic for a CVS, especially first thing in the morning. But, again, it wasn't busy there at that time. Moving on to this now. We've mentioned New York City a few times before for Mpox, and just a reminder once again, here's an article here. We're just going to read a headline. Mpox cases ticking up yet again in New York City. Health officials warn, and yes, from time to time there are spikes of Mpox. I really wish we could get some wastewater scan sites in the boroughs of New York City. I mean, we don't get New York City hasn't updated on the CDC page, at least for COVID, in quite some time. It would sure be nice to get them on wastewater scan. We would be able to see Mpox cases in wastewater scan. If you want to read this full story, I did tweet it out, as we don't have enough time to actually read all these stories here while on camera, else our videos would be an hour long. Alright, in Ontario, measles cases are approaching a high set a decade ago, and there is a little piece here that I want you to hear about. As of May 8th, there were 21 confirmed cases of measles in Ontario, while in 2014, there were 22 confirmed cases of measles in the entire calendar year, according to Public Health Ontario. So get where I'm coming from here? We're in the month of May. That's 5 months into the year. Already 21. And in 2014, they had 22 for the entire year. We still have several months to go in this year. We have all summer and all fall yet to come, and the rest of spring, too. So, yes, good chance Ontario is going to pass that 2014 number. Alright, moving on to this. Something we talked about yesterday, but we can go actually a little bit further today because I did something yesterday. Last night, I should say, after the video, I decided that we talked about MLB viral illness yesterday. In other words, a lot of players are getting sick. There's a lot of players coming down with viral illness. We had a thread going on X, and then we found out Chicago Cubs have a player now that's dealing with viral illness. I said, you know what? It's time that I start a thread on the site to archive this, and I did just that. And already, take a look at this. How many postings there are already. And mind you, I did not add. There were some cases that occurred earlier at the start of the season. I know Cincinnati Reds had a few cases, so I'm going to try and get that in there as well. And maybe I'm going to put some dates on here when these players are, coming up with illness. Again, a lot of them are saying viral illness. We're not hearing the words COVID. We're not hearing the words flu. We're not hearing just what it is. But what we do know is there is definitely something going around in the MLB at this time. Alright, moving on to this, also on the site. My moderator, Steve, posted this the other day. We did not get to read the story, but we do now. And cases of whooping cough, pertussis, in the state of Oregon are now 120. Yes, there have now been 120 cases of pertussis, otherwise known as whooping cough, so far in 2024, as opposed to 17 cases by this time last year. This is a significant increase year over year. And in Lane County, a community-wide outbreak has been declared with 40 such cases. So this is a serious issue, and he did provide a link to the article with the story. So yes, whooping cough, it's out there. It's an issue. Alrighty, moving on now to take a look at today's pollen levels. Let's refresh and see where we are. Not seeing a lot of red on the map. We are seeing a lot of orange on the map, generally in the northern portions of the United States. 35% of the country is in medium status, and there are some areas, once again, in the red. Western Pennsylvania, Ohio, Illinois, Indiana, the Plains, the Pacific Northwest, all seeing a lot of orange. The South, my friends, is not doing too bad at this time. Let's take a look at air quality levels. We need to refresh this. And we're going to find a mixed bag with, again, bad air qualities in the central region. Look at this, in the south. So you must be getting a wind today. I haven't checked wind directions, but if you get a wind out of Mexico, you're going to be in the bad air quality again because there are wildfires continuing to ongo in Mexico. And add in the fact that in southern Texas, you're dealing with some extremely hot weather as well, but you're also dealing with some thunderstorms today, and we'll show you that in just a moment. And as we come up north here, Great Lakes, yeah, oranges, yellows, they are a thing. The East Coast is not doing that bad. A lot of greens here, some really low levels, because there's a coastal system that is just spinning off the coast. That's helping to keep the atmosphere clear. And take a look at this. Florida is in the yellow, and of course our usual spots in California. Once again, LA, San Bernardino, Santa Barbara, seeing some issues. Not as bad in Santa Barbara. And then Fresno, Sacramento, some issues for you as well. Not terrible in the Pacific Northwest today. North Dakota, you are seeing some yellow as well. Again, remember, Canada also has some wildfires. Taking a look at today's severe weather risk from the Storm Prediction Center, and it does show that a tornado watch was just issued in portions of eastern Texas and portions of Louisiana. If you live in this area, please be mindful. There is not only the threat of tornadoes, the threat of wind damage, and a hail threat as well. It looks like what is known as a mesoscale convective system has developed. In other words, meaning a system with severe thunderstorms, a complex of severe thunderstorms that will travel several hundred miles from Texas right on through to the Gulf Coast of Louisiana. So be mindful of that. If you want to learn more about the weather and climate, I do have a Twitter page where I do just that. It's called Climate Data Report. It's at Climate Data, capital RPT. So it's Climate Data Report. All right, moving on now to this. And Philadelphia yesterday, where is it? Here it is. For Wednesday, had 763 total EMS incidents. Doing a live look in at Montgomery and Chester counties, and hopefully it's not as busy as what it was. Well, there's still quite a few calls ongoing in Montgomery County. 13 active calls. It was higher a little bit ago. And taking a look now at what is going on in Chester County, where it has been busy all afternoon. There's been a lot of injured person calls today. And it still is busy. Again, not as busy as it was a little bit ago, but hey, we do see sick person, diabetic emergency, and a whole bunch of different things going on there. Walgreens this week, the national positivity rate is 15.3%. The prior week is 14%. That is a difference of up 1.4%. Testing, however, is down. Total tests, 3,565. The prior week is 3,763. Alrighty, moving on to wastewater now. Normally we would go to an individual site. Stay tuned. We may go to an individual site. First, we have to take a look at the national level and one of the regional levels. Something concerning is going on here for COVID. Here's the national level for COVID. Take a look at this. Yes, we are starting to see a rise on the national level here with wastewater scan for COVID. It's concerning. KP.2, it's out there. Again, I still think here in the United States, it's just going to be a bump in the road, but you know what? We really need to pay attention. I mean, there's always potential. It could get worse than expected. And, well, let's take a look at the West Coast. Well, no, first, let's go over the other viruses here. RSV at this time is low. Influenza A, as of May 10th, rose a little bit. And I should show you here, as of May 10th, it's the same thing for COVID. So these numbers are as of May 10th on here. Taking a look at Influenza B, it's dropping. HMPV on the national level went up a little bit, as did norovirus. And it does look like it's just a one update, big jump for some reason, so I don't always take it that oh so seriously. But now I want to show you this. Let's go out to the West Coast region. Let's take a look at COVID. Take a look at this. This is not a one update jump. Since April 24th, it was rising. Then you come to May 7th. Not one, but two updates say it is now rapidly rising in the West Coast. And we did see San Francisco the other day, which was showing COVID levels going up there as well. Again, COVID in the West Coast starting to rise, and it's starting to rise a little bit faster. So something we do not like to see. RSV is low at this time. Influenza A is actually showing a drop on the most recent update. We'll have to see if that continues or not. Again, that's just a one update change. Influenza B is up on the most recent update, but again, that's just a one update rise. HMPV is dropping, but norovirus, wow, is really starting to pick up the pace here, and that's not just one. That is two updates that now show, hey, norovirus is starting to rise in the West Coast. And while we're at it, we might as well show you the other regions as well. The Midwest, there is an ever so slight rise for COVID at this time, but nothing like we are seeing on the West Coast. RSV is dropping. Influenza A and Influenza B, thankfully, are dropping at this time. HMPV seeing a slight rise, and norovirus is dropping at this time. Now taking a look at the South. I know, it's not wastewater day, but we have to show you this because this data did update. We'll have our full wastewater day on Sunday unless it's a busy news day, like it has been quite often lately. In the South, we are seeing a drop for COVID, a drop for RSV. Influenza A, the most recent update now shows a drop after it was seeing a rise since May 2nd, and that's something we're going to have to continue to watch. This drop could easily get corrected on the next update, and Influenza B is dropping as well. And finally, we go to the Northeast, and in the Northeast at this time, we're seeing a slight rise for COVID. Most recent update dropped a little bit. We'll have to keep an eye on this. RSV is low. Influenza A is dropping at this time. Influenza B is dropping. HMPV is seeing a rise of some sort. And norovirus, still in high levels in the Northeast. I would say at least moderate to high, and it is dropping ever so slightly at this time. Alrighty, moving on now. As you know, the most recent variant that is dominating is KP.2 at 28.2%, and JN.1 comes in second. That variant caused a winter surge at 15.7%. We will get an update on all the CDC data tomorrow. That's why we're not showing much of it to you today, because we still have several other things to look at. New Jersey today, 147 hospitalizations, with 65 out of 70 hospitals reporting, 9 people on a ventilator. In the ICU, 17 discharges, 27 at this time. All right, moving over to New York State now. You may notice I have this set up just a little bit differently today. That is because New York State today reported 829 new cases. So today is this is as of May 13th. Today is not May. Today is May 16th. But this data is as of May 13th. I guess that's the day where the cases come from, as you can see on here. So we have to go all the way back to March 18th is the last time they had more than 829 cases, which on that day they had 830. So yes, highest number in New York State in a while, and as you know, hospitalizations like cases, and as you know, or maybe you don't know, this does not include those at-home tests. So there is definitely a rise today in New York State. It's something we'll have to keep an eye on. Could it lead to a long-term rise? It could. It could lead to just a bump in the road. Hey, it could be the start of something, and it's the highest level in a while. So anytime we see a number come in higher than it has been coming in lately, it's something we keep an eye on, and it could also easily go right back down in a few days, and we hope that would happen. Taking a look at hospitalizations, they're definitely not dropping anymore. I mean, they're down slightly day over day, but you can see here, overall, the sustained drop that was occurring. They're starting to hit a baseline here that is, not dropping any further, and the next wave would form off of the levels that they are at now, and currently 450 people are hospitalized in New York State. In the ICU, there's currently 40. I had hoped New York State would get below 400 before another wave comes. Could they turn around and start dropping again? Yeah, they could, but it's not looking as likely right now. It's looking like they're either going to stay in the 400s or maybe go up ever so slightly, especially now that we're seeing a bump in cases. That should translate to a few more hospitalizations in the coming days, or maybe as early as next week. All right, we have to move to another browser now real quickly. Why? Because we have more data to take a look at. And this is the state of Connecticut. Connecticut so far this week, 70 COVID cases, 64 influenza cases, and just 2 RSV cases. This is not complete for the week. I mean, obviously you still have the rest of today, tomorrow, and the weekend. So that will eventually get added in. The total for last week was 207 influenza cases. The previous week had 274 COVID cases and 19 RSV cases. Taking a look at Chicago, Illinois now, hospitalizations in Chicago, they're down ever so slightly, and they actually have a page for this, and you can see the hospital rate or admission level right now in Chicago is low, and you can clearly see on the chart it continues to drop. So that is a good thing. A number of cases are down from the prior week, and mind you, the daily average being 38 again doesn't include these at-home tests, so that is likely not the real number of cases. Deaths are down at this time. Doesn't look like they're reporting any deaths right now. Very few, if any, deaths. That's good. And vaccinations, 1,531 people vaccinated with either first shot, second shot, or a booster shot in the last week. Taking a look here, Massachusetts did not update yet, so we'll probably have to get that to you tomorrow. coming to an end now with the state of Washington, and we can see here, influenza is down 20% for emergency department visits, no change for COVID or RSV. Hospital admissions did not change for COVID or RSV. It's down 33% for influenza, less than 10 people in the ICU for COVID and influenza, and of course they do not collect data for RSV. Alrighty, that concludes the Thursday edition of the Pandemic Update. We covered a ton of topics today, between the masking ban that's looking like it's going to be a thing in North Carolina to everything else in between. Please continue to keep each other safe. Continue to mask. I mean, come on, it is really important that we do that, and the easiest way to be informed of what's going on, just watch my updates every day. I try and do them 7 days a week, as many days out of the year as possible, because this is really important that we are in the know of what is going on with all these viruses. Want to stay informed more often? Subscribe down below. Liked what you see here? Give it a thumbs up. The more times you hit that thumbs up button, the more this content gets pushed out throughout the algorithm. And of course, share these videos with anyone you know. And once again, if you got a comment on anything today, or maybe something I got wrong or something I did not add, leave a comment down below. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Thursday evening. Thanks for watching.